Hi, this is Dr. Lori Bagai here at Smart Smile. We get a lot of questions regarding tooth cavities, so I'm going to answer some of those questions for you today. Dental cavities are basically, germs eating away at your teeth. So basically, your tooth is food for the germs. So when you provide it with food, any food that you're eating, the germs want to eat that too. When they eat the food that is sitting on your teeth or in your mouth, they poop acid, and basically that acid eats away at your tooth, and that is what is a dental cavity. So basically your teeth keep rotting away because of the acid. Cavities are caused by germs. Like I said, there are some very specific cavity germs which get passed on from, one family member to another as soon as a baby is born, basically. And those germs are the ones that cause cavities. A dentist has a couple of different ways of checking for cavities. One is x-rays, and the x-rays show some of the cavities that are not visible with the naked eye. And some of the cavities are checked for by the doctors in the mouth. So with a combination of x-rays and the dentist, we find cavities. A cavity has several different stages. It's just a very beginning and start of the cavity when it's like not really a cavity that needs to be filled. Then the dentist will tell you about, eating right or brushing right or flossing right. All those three things are really, really important to prevent cavities. And if we don't do all those three, then, cavities start. So there are very beginning stages. Then there is like a middle stage. There is a stage at which the cavity needs to be filled. And then there is a very, very advanced stage where, now you're talking about root canals or crowns or possibly taking your teeth out. Yes, most definitely. Once the germs are in your mouth, they are basically reproducing. So I always say, are the germs winning or you are winning? So if the germs are winning, they will definitely spread and attack all your other teeth. If you're winning, then you can control it. So that is why it's really important to attend to a cavity as soon as it's found. A small cavity needs to be filled as soon as possible so that it doesn't spread to all your other teeth. A cavity stops from progressing by getting it treated at a dental office. For most people, the recommendation is to see the dentist every 6 months, so twice a year. Sometimes if you are at high risk, then the dentist might ask for you to be seen a little sooner than 6 months, depending on your personal circumstances, your health, or the situation of your mouth. So if the cavity is in like a very, very beginning stage, then the dentist might talk to you about just observing it, trying to make it go away. But if it is beyond that very initial stage, then no. In order for a cavity to be caught at the initial stage, you have to make sure you're on top of your visits to the dentist. The fillings can last for a good amount of years, maybe 2 to 5 years or so, sometimes even more. It all depends on how you're eating, drinking, brushing, flossing, your general health. So there are several parameters that control how long a filling can last. But generally speaking, the best way of making fillings last is keeping up with your dental visits. Yes, most definitely. If you're on top of your dental cleanings and you're getting your teeth cleaned in those hard-to-reach areas, which all of us miss, then those areas will not develop cavities because that is where the germs take a foothold and eat away your teeth. So yes, cleanings can definitely prevent cavities. If you suspect that you have a cavity, you need to go to your dentist as soon as possible and give them a call at 714-744-1242. to schedule an appointment immediately. I hope we were able to answer your questions here at Smart Smile Dental. And if you have any questions, do not hesitate to give us a call at 714-744-1242. We have immediate appointments available and we would be glad to see you as soon as possible.